Alright, today we're going to talk about CHF. CHF is congestive heart failure. It's a chronic progressive condition of the heart, and it affects the pumping power of your heart muscles. Unlike other heart failure, it's a little bit different because congestive heart failure has to do with fluid building up around your heart and making the muscles harder to contract and pump. We're going to go over a few parts of your heart first in the chambers. You have 4 chambers in your heart. You have your 2 upper atriums and your 2 lower ventricles. The ventricles are going to pump blood into the organs and tissues of your body, and the atrias are going to receive blood from the body and circulate it back to the rest. So when we have congestive heart failure, sometimes you have certain signs that you can tell before that, and when it's starting to begin, and that's fluid building up in your lungs. You could hear some sounds from that if you listened. You can also get pedal edema, swelling and fluid in your abdomen, your liver, and lower body in general. So when CHF develops, your ventricles pretty much can't pump blood sufficiently to the body, or at least the volume it needs. And when that happens, eventually the blood and other fluids start backing up, and that's why it's caused. It can be life-threatening, and if you suspect you or someone near you has CHF, you should seek medical treatment pretty soon, because it's a very serious condition that you can have. Most common types of CHF that you're going to have is probably going to be left-sided congestive heart failure, which can eventually lead to right-sided congestive heart failure. It occurs when your left ventricle doesn't properly pump blood out of your body, like I was saying. So you start building up fluid around it, pressure, and your heart's having a really hard time to actually do its job because of the liquid and the weight of it pushing in on it really hard. You pretty much have 2 kinds of left-sided heart failure. You're going to have your systolic heart failure and your diastolic heart failure. Your systolic heart failure occurs when the left ventricle fails to contract normally, and this produces a lot of force to push blood in your circulation. Without that force, your heart can't really pump. And then your systolic failure is a dysfunction when the muscles in the left ventricle become stiff and they don't want to open back up and bring more blood into your heart so that it can pump it out. So both of these are pretty bad, and both of them need medical attention. Right-sided occurs when the ventricle has difficulty pumping into your lungs, and when it starts getting congested, it can actually fill up your lungs with fluid, and then your alveoli and capillaries are going to have a hard time doing their job. So both of these are very serious, but mostly they start on the left side typically and move over to the right. So if you have right-sided congestive heart failure, you have a good chance of having left-sided congestive heart failure also.
And next we have signs and symptoms, which is fatigue and weakness, edema, irregular heartbeat, and dyspnea. And next we have treatments.
Your treatments are take vitals, positive pressure ventilations, sit upright, get meds, nitro may be of value, and transport.
Elaborate on one of them. Just pick one and talk about it.
The value of sitting upright is when you sit a person upright, it will allow their chest to expand more efficiently.
Alright, and then we're just going to go over a couple of stages of congestive heart failure that you can kind of use to gauge and see where and how far you are in it. You have stage 1, which typically you don't experience any symptoms during physical activity and stuff like that, or very little. And you can also manage it through good exercise, eating, choices of lifestyle like that. After that, you'd pretty much move into type 2 or stage 2, and your normal physical activity may cause for fatigue, palpitations that are a little irregular, and you can pretty much get shortness of breath pretty quick and stuff like that. That's going to be your stage 2. You might need to actually get on some medications to help change and fix that problem at that point. And obviously, as we go on, stage 3 is going to be a little bit worse than that. and you're likely to be comfortable at rest. But if you're doing anything else, it's going to be really restricting for you. So not even physical activity or working out, but just getting up, walking around, you're going to feel shortness of breath. You're going to have trouble breathing at that point. And then you go on to stage 4, and you're most likely unable to even carry on any amount of physical activity at all. Waking up in the morning, sitting up is going to be hard. And at that point, there's no cure for that stage, but you still have a quality of life that you could palliate your care options and still do some things in life. To move some of this fluid and to fix some of these things and problems of CHF, you're going to want to use, as an EMT, if you see any of these signs, you're going to want to go ahead and use CPAP, and that is going to help you actually move some air into there and kind of push that liquid and that fluid back out of that alveoli area, that wall, and hold it back some so you can actually get some air and you can get some perfusion going on. Alright, so that was our quick lecture on CHF. Remember the signs, symptoms, and treatment of that, main treatment being CPAP. Have a good day.